The 1918 influenza pandemic, often referred to as the Spanish flu, was one of the deadliest pandemics in human history. It infected an estimated 500 million people worldwide, about one-third of the global population. At the time, and killed approximately 50 million people. Though some estimates suggest the death toll could have been as high as 100 million. The pandemic occurred in the final year of World War I, 1914–1918, and its rapid spread was exacerbated by the movement of troops and the close quarters of military camps and hospitals. Origins of the 1918 flu. Despite its name, the 1918 flu did not originate in Spain. The exact origins of the virus remain uncertain, but there are several theories. United States. Some evidence suggests the virus may have started in Haskell County, Kansas, where a severe flu outbreak was reported in early 1918. From there, it spread to Fort Riley, a nearby military base, and then to other military camps. Europe. Others believe the virus may have emerged in Europe, possibly in France or the United Kingdom, where large numbers of soldiers were stationed. China. Another theory points to China as a potential origin, as there were reports of respiratory illnesses in the country before 1918. The name Spanish flu arose because Spain, a neutral country during World War I, was not subject to wartime censorship. Spanish newspapers freely reported on the outbreak, creating the false impression that the disease was particularly severe there. Characteristics of the virus. The 1918 flu was caused by an H1N1 influenza A virus, which was highly contagious and unusually deadly. Unlike typical seasonal flu, which primarily affects the very young, the elderly, and those with weakened immune systems, the 1918 flu disproportionately killed healthy young adults between the ages of 20 and 40. This phenomenon is thought to be due to a phenomenon called cytokine storm, where the immune system overreacts to the virus, causing severe inflammation and damage to the lungs. 3 waves of the pandemic. The 1918 flu occurred in 3 distinct waves. 1. First wave, spring 1918. The initial wave was relatively mild, with symptoms similar to those of seasonal flu. It spread rapidly through military camps and civilian populations but caused relatively few deaths. 2. Second wave, fall 1918. The second wave was the deadliest. The virus mutated into a more virulent strain, and the death rate skyrocketed. Hospitals and medical facilities were overwhelmed, and many victims died within days or even hours of showing symptoms. 3. Third wave, winter 1918–1919. The third wave was less severe than the second but still deadly. It continued into 1919, with some cases reported as late as 1920. Global spread and impact. The pandemic spread rapidly due to the movement of troops and civilians during World War I. It reached nearly every part of the world, including remote Pacific islands and the Arctic. The impact was devastating. United States. An estimated 675,000 Americans died, reducing the average life expectancy by about 12 years. Europe. Countries already ravaged by war, such as Germany, France, and the UK, suffered heavily. India was one of the hardest hit countries, with an estimated 17 million deaths. Africa and Asia. The flu caused significant mortality in regions with limited healthcare infrastructure. Response and public health measures. At the time, the cause of the flu was not fully understood. The influenza virus was not identified until 1933, and there were no effective treatments or vaccines. Public health responses varied. Quarantines and isolation. Some cities implemented quarantines and isolation measures, which helped slow the spread. Mask wearing. Masks were widely used, though their effectiveness was limited by the materials available at the time. Social distancing. Schools, churches, and public gatherings were closed or restricted in many areas. Hygiene campaigns. Public health campaigns emphasized hand washing and avoiding close contact. Despite these efforts, the lack of a coordinated global response and the absence of effective medical treatments meant that the pandemic continued to spread unchecked. Aftermath and legacy. The 1918 flu pandemic had profound social, economic, and medical impacts. Medical advances. The pandemic spurred advances in virology, epidemiology, and public health. It highlighted the need for better disease surveillance and international cooperation. Economic impact. The pandemic exacerbated the economic disruption caused by World War I, contributing to post-war recessions. Cultural impact. The trauma of the pandemic left a lasting mark on survivors and influenced literature, art, and public memory. Scientific discoveries. In the decades following the pandemic, scientists worked to understand the virus. Virus identification. The influenza virus was first identified in 1933. Genetic analysis. In the 1990s, researchers successfully reconstructed the 1918 virus using genetic material from preserved tissue samples. This confirmed that the virus was an H1N1 strain and provided insights into its virulence. Lessons for the future. The 1918 flu pandemic serves as a stark reminder of the potential for infectious diseases to cause widespread devastation. It underscores the importance of global cooperation in disease surveillance and response, investment in public health infrastructure and medical research, preparedness for future pandemics, as demonstrated by the COVID-19 pandemic in 2020. The 1918 flu remains a defining event of the 20th century and a critical case study in the history of public health.